name is Nayan Kim. I'm a senior nurse from AET and I will be assessing the vital signs and also the respiration along with the blood pressure, and also I will be asking some questions to a patient. But right now I will be washing my hands before I assess my patient, and this is for infection control. Infection control purposes, I will be wiping my workspace, and I will put gloves on, and also for the same purpose. I will now place the paper towel, and this will go in the bin along with the gloves. Hi, my name is Nayan Kim. I am a student nurse from AUT and I will be your nurse today.
Yep.
And today I will be assessing your vital signs, your blood pressure, your respiration, your pulse, your radial pulse, and also and I'll asking you about some questions about your injuries. And also I will be assessing your oral temperature just to see if you have fever or anything like that.
Okay, alright.
Yeah. Hi, so this is Esther Jong, and she has given me consent to film this and be part of this film, and I will be assessing her vital signs such as checking her radial pulse, her blood pressure, her respiration, and also asking her some questions about her injury. First of all, Esther, if you allow me, I will be taking your oral temperature.
Okay.
And so, just because for infection control purposes, I will be sanitizing my thermometer.
Okay. Just guide us.
Yep. Just put it under your tongue
Mm-hmm.
and just stay still until it beeps. Thank you. So your oral temperature is 36.7 degrees. The expected range is 35.6 to 37.7. And as you're within the expected range, I'm sure that you're pretty healthy.
Okay.
And I will just sanitize this one more time. Just remove these gloves. So now I will be checking your radial pulse.
Okay. What do I do?
And I'll just be using this watch. I
Okay.
just need to stay. I just put this up here. And just thank you, Esther. So your radial pulse is 69 beats per minute,
Okay.
and the expected range is between 60 to 100 beats per minute. So you're within the expected range.
Okay.
And also I took your respiration, which is the number of breaths you take per minute, without asking you, because some people change their breathing rate if I tell them.
Yeah.
And your respiration rate is 16 breaths per minute.
Okay.
Yeah.
Okay. Alright.
And the expected range for that is actually 12 to 20 breaths per minute. So you're within the expected range. So I'm thinking that you're pretty within the expected range.
Okay. Alright.
Thank you. So hi Esther, I will just be taking your blood pressure right now, and this is just an indication of if you have any problems with your cardiovascular health or not.
Okay.
Yeah. So you just take one arm out so that I can take your blood. Yeah. And I'll just put this under here. Yeah. Thank you. Just be careful with that. I'll just take the air out of this. Yeah. Just this here. Is it too tight? Is it
Alright.
okay?
Yep.
Yeah. Seems good for you. that's good. And I'll just clean my hair for you. Just for infection control purposes.
Alright.
Thank you for that. Did it hurt anyway?
Oh, that's alright.
Yep. Just take this off for you. So is that your blood pressure? Well, your systolic blood pressure was 112, while your diastolic blood pressure was 72. The diastolic blood pressure is when your heart is relaxed, and the systolic blood pressure is when your heart contracts. And the expected range for your systolic blood pressure is between 90 and 140, while for your diastolic blood pressure, it is between 50 and 90.
Okay.
So you're all within the expected range,
Yeah.
and it seems okay with you.
Okay.
Yeah,
Alright.
and it seems that you're really healthy right now.
Okay.
Thank
Thank you.
Yes, this.
Mhm.
So could you tell me about your injury?
So last night I fell off my bike.
Oh, last night?
Yeah.
Okay. So last night you fell off your bike. And could you tell me where you in, which area of your body you have injured?
I hurt my right elbow.
Right elbow.
Yeah.
Okay. So could you describe the pain to me?
It's quite throbbing. Feels like it's poking it with a knife. Yeah.
Okay. So has there been any swelling or any redness in the area?
A bit of swelling.
A bit of swelling. So from a scale of 0 to 10, 0 being no pain and 10 being the most painful, where would you point this pain to be?
7.
7?
Yep.
Okay.
Yeah.
Oh, it must be quite painful. So do you remember when this pain began? Like, is it
I think-
exactly straight after, or is it a few hours after?
I think it was 3 hours after the accident.
So is it just straight up, like, is it just that event, that one event that caused this?
I think so. Yeah, I think it
Okay.
began after my
Okay, that's good. Well, that's not good, but. So is it just your right elbow that's hurting?
Yeah, I think it's just like a pain overall.
Just overall in
in
the right
area.
arm?
Yeah.
Okay.
Yeah.
So has the pain been constant, or does it just come and go?
It's been fairly constant.
Okay.
Yeah.
So have you taken any medications to relieve this, or have you done anything to that increases or decreases this?
I've taken Panadol.
Panadol?
Yeah.
Is that all?
Yeah.
Okay. So have your like symptoms restricted you from doing anything that like actions that you would normally be able to do, such as lifting heavy objects?
Yeah. I can't really lift my arms.
Oh, okay.
I can't pick things up. Yeah.
Okay, so thank you. So I'll just repeat it after you, and if there's anything wrong with it, you would please tell me about it. So what happened was last night you fell off your bike and think you hurt your right elbow.
Yeah.
And so there's throbbing, poking, it feels like you're poking it with a knife, and there's a bit of swelling once you've seen it. So on the scale of 0 to 10, you scaled it as 7, which means that it's quite painful for you right now, even at this moment.
Yeah.
So it began hurting feeling painful a few hours after you fell off your bike.
Mm-hmm.
And it's not just your right elbow, but just your overall right arm that's feeling painful, and the pain is feeling pretty constant. And you've taken Panadol to relieve, but it's not really helping. And it's just preventing you from doing some ordinary actions. Okay. Thank you for that. I'll just call a doctor for you, and you can have a talk with them.
Okay.
And thank you for everything else.
Yeah.
Thank you.